I see people coming in. So in the meantime, I'm going to start with some house rules, and then I'm going to welcome my co-host for the evening, who is also going to give a special message to the dental assistants. Please refrain from using the raised hand button or panel at the bottom. Type your comments or questions in the Q&A tab. This evening makes you eligible for 1 CEU, this CPD evening. So your certificates will be loaded on your profile on the SADA website. If you are not a SADA member, you are able to create your profile on the SADA website. Then you can also get your certificate. We are live streaming on YouTube for those that will have a problem, for those that are struggling to get in via Zoom. We are live streaming on YouTube as well. I must also remind you that there is an evaluation form that you need to fill out after the webinar. You need to fill it in at the end of the webinar. And even during the webinar, there will be polls that are coming up on the screen. So keep your eyes on the screen so that you're able to participate in the polling. Without wasting any time, I'm going to hand over to Miss Melanie Savides. Melanie has a background in dental assisting. She used to be a dental assistant many years ago. She is now a dental trader, and she's the chairperson of the Dental Traders Association. Melanie, I'm going to hand over to you.
Thank you, Dr. Mitsing. Thank you for the invitation. On behalf of the Dental Assistants Association, I've been asked to speak on behalf of Joyce Rafidi, who is the current chairperson and president, I should say, of DASA. She is unable to join us as she's not well this evening. I'd like to recall my first meeting with Joyce Rafidi. It happened to be in the current Dental Association offices in 1984. So in 1984, and the dates are clear in my mind, a group of us dental assistants, and there were about 85 assistants, came to the building, which is the current building of the Dental Association today. And we used to meet on a regular basis in this building as a small group of 85 dental assistants. We had no real place recognition at that time as dental assistants. And it was my first meeting with Joyce Rafidi. So it is quite interesting that there were many of us together, and Joyce was there. She was a dynamic woman at the time, younger, much younger version, but strong. She made it her life's mission to get recognition for dental assistants. And it is so special that you have asked me to talk about her, and basically a little bit about her, and also the association to celebrate this Dental Assistants Appreciation Week. Dental assistants play such a special role in the practice, and we need to highlight what we can actually do in a practice with dentists. We need to, as I always say when I speak at different lectures, to make ourselves indispensable as a team member. We need to play as team members as well. We need to support the practice in many ways. You need to market your practice. You need to be part of that team that helps the dentist. And ladies, you all know at 4:30, you wane a little bit. You feel a little bit tired, and in walks something like a cracked tooth, because we have to remove this cracked tooth, and it's not going to be quick. It's not going to be easy. And that's when we really play these important roles as assistants. And so I know that dentists appreciate you, and I have had the most wonderful career becoming a dental assistant and working with dental assistants in a business, and now with my training dental assistants to be more functional as team players in the group. So thank you for the invitation, and I'm so pleased that we appreciate dental assistants.
Thank you very much, Melanie. Indeed, dental assistants are very important in a dental practice. I mean, I've had the opportunity to work with the most wonderful dental assistants in my career. So I can definitely attest to that. Without wasting any time, colleagues, let me introduce our speakers for the evening. We've got very wonderful speakers lined up for you tonight. I'm going to introduce both of them and then ask our first speaker to start speaking. The first speaker is Mrs. Tebatso Mutibi. She has been serving since 2015 up until date on the Dental Assisting, Dental Therapy and Oral Hygiene Professional Board of the Health Professions Council, the HPCSA. She is the chair of the Preliminary and Professional Conduct Committee of the Dental Assisting, Dental Therapy and Oral Hygiene. She is serving on the Education Committee as a member of the board. From 2014 until 2020, she held the position of a junior lecturer at the Tshwane University of Technology, coordinating the dental assisting program. Currently, she is the practice manager of Dr. M.M. Mutibi. I presume that's her husband. Okay. And then our second speaker for the evening, who will speak after Mrs. Mutibi, is Elise Jacobs. She is a dental assistant and has been such since 1987, and an internationally certified laughter teacher. Elise says that she is an energetic, positive, and determined individual. She finds great joy in uplifting, teaching, and motivating people. Her greatest strengths are to approach practical problems and solving them in a clear and logical way. And without wasting any time again, I'm going to hand over to Ms. Mutibi to start, and then Elise will follow after that. Thank you, Ms. Mutibi. Over to you. Tebatso, I think you're muted. We can see your screen, but we're not hearing any sound.
Can you hear me now?
Yes, we can.
Thank you very much. Good evening, everybody. Our bosses, dental assistants, oral hygienist, therapists, thank you. I believe we're going to have a fruitful evening tonight as we learn from each other. Thank you, Melanie, for also what you've said earlier on about dental assistants. We really appreciate it. Regardless where I go in life, I'll know that I'm a dental assistant at heart. So without wasting any other further time, I will start with my presentation for the evening. The topic is psychological impact of COVID-19 on dental assistants. Pool 1, the first question can go up, please.
Sorry, Tebatso, are you sharing any screen?
Is it not sharing?
No, it's not sharing yet.
Okay, let me. Are you still not seeing it?
Nothing yet.
Sure, I am sharing.
Okay, the poll is up, so members can continue with the poll, and then you can share your screen in the meantime.
Dr. Mitsing, please keep busy. I don't know what just happened.
Okay, all right. Elise, maybe you can give us a bit of laughter there.
Yes, ladies, that is technology for you. So let's just laugh about this situation. You know what? Technology, we're learning such a lot here. And maybe I can share where laughter came from so long. And when you guys are ready, you just give me a note. Laughter was started in 1995 by a medical doctor. There we go. We sorted. Are you okay? There you go.
There we go.
Thank you.
Thank you so much. Dr. Mitsing, Merlis, you can share the first pool. There you go. I can see that 39% are dental assistants, 46 dentists, 11% oral hygienists, and other 6%. Thank you very much. So we've got a lot of employers tonight. Okay, what is COVID-19 to us? What does it mean to us? Without being scientific all about it, we know that it's a new virus. We don't know much about it. And we don't know what we're really dealing with. Every day it changes. Today it's this, tomorrow it's this. WHO say this today, tomorrow they say this, but we don't blame them because that's what the new virus does. Clarity on the mode of spread. Initially, when it came out, they said through coughing, sneezing, touching. Now it's airborne. Where is it taking us? Also, it was also known as a winter virus, but suddenly when the second wave hit us, it came in the middle of December, scorching heat of December. Hot, cold, we don't know. Also, when it comes to the medical management, it's a trial and error. So medical doctors are trying to manage this disease, but can they really, this virus? On particular times, it's most of the time they're trying to manage the symptoms rather than the virus because they don't know what they're dealing with. Nothing is definite. And because of the uncertainties, hospitals were not ready for the impact. A lot of things happened, a lot of damage happened. The hospitals were fully occupied. Shortage of beds, shortage of staffs because some staff were getting sick, and there was a high mortality rate. Initially, when it started, you had 200 new infections per day. Then it was 1,000. Then it was 2,000. Then it went up to about close to 23,000 new infections a day. Then it became worrying. To the very same numbers, the numbers turned into names, and the names turned to people that you know. So a lot of worries started crumbling up on ourselves, and we were left with a lot of unknown, a lot of unhappiness, a lot of tears. But yet life had to go on, you know, because what did COVID-19 mean to you as a dental assistant? It meant now we were sitting with new working conditions. What does that mean? You now had to adapt to new ways of infection control. Not that it was never there, we just did things differently because it worked and we didn't get in trouble for it. It meant that we had more responsibilities, meaning you have to stand in for 6 staff. Sometimes you're a receptionist, sometimes you're a cleaner, sometimes you had to be at the screening station, but you had to step in because that's what we do. We had to adhere more to PPE regulations. If you think about it, from day one, we had to use gloves, we had to use masks, we needed to use goggles, visors, all sort of protections needed to be used, but we never really used it because it was safe enough to use gloves and face masks. Now, suddenly with COVID, we're sitting with more, we need to adhere more to PPE use, and which meant more expenses to the practice. Also, another worry that came in factor is that we are working in a dental practice. We know the aerosol in the practice we deal with. That was enough worry already on its own. Another thing that meant you might be sitting with a stressed out employer. The employer is worried about himself or herself, worried about you as staff, worried about their own family, they're worried about their own patients. What is the way forward for them? So now you're sitting with an employer or a supervisor that does not always have the answers to everything, and you have to be part of this team. There was also a possibility that the practice could close down. And if it closed down, what did it mean for you as a dental assistant? What did it mean for the employer? What did it mean for your family? But we're all sitting in this thing and we're like, what is the way forward? In all of this, there was also a possibility of a loss of income. And as where we're sitting, we all know that there were dental assistants who were sitting between April and June who had either a cut of income completely or a reduced income. What did that do to you mentally, physically, emotionally? What did it say to you? On top of what we've just discussed, it went on, it didn't stop there. There were risk factors that could lead you to having a mental health challenge. The small dental practice space that we work in, number one. Some of our patients, as we know them, they don't show symptoms. They never show symptoms, but 2 days, 3 days later, after they've left the practice, you find out that Mrs. X, who came 3 days ago, tested positive. What does it mean for us? Do we close down? What does the employer do? Can we afford to close down? Some patients, some individuals are also not always honest about their symptoms, because why? They want treatment. They need treatment. So they don't always tell us where they've been, their symptoms. They get the treatment and boom, 3 days later, you find out through a friend or somebody else that one of your patients tested positive a few days ago, but yet they came to the practice. What do you do about that as well? And then you're also sitting with non-communicable diseases, your own comorbidities. The funny part that initially when it started, diabetes was high up. But lately it has shown that of all the hospital admissions, obesity, hypertension, and your heart conditions are the 3 leading conditions that patients get admitted into hospital for. Diabetes was a little bit low down. So if you're on a bit on the obesity side or you've got a hypertension, you knew then, oh, what's the risk? And if you have any of these conditions, do you continue going to work or do you sit at home and wait for a miracle to happen? Sitting at home is always not an option, or it's also not always feasible for anybody. Also, another common risk was public space and public transport. We know that the majority of our dental assistants use public transport. It's not a secret. We all know that. And we don't have a say. We can't control what happened in public spaces or either in public transport. We get in, we get to work. We get out, we get back in the public transport. Regardless how safe you were at work with the best PPEs, at the end of the day, if you still have to get in public transport, you still have to get in public transport. And public spaces, even if you decide to stay at home and you only go to work, you still need to get to the shops and buy basic things. You can't always rely on people to say they'll do the groceries for you or rely on checkers to do the 60-minute drop-off for you. Sometimes you want to get personal things for yourself, and Mr. Delivery can't do it for you. Also, another risk factor was PPEs distribution. As I was speaking to one of the assistants, a few of them mentioned that there wasn't necessarily a lack of PPEs. The problem was a distribution point where the personnel responsible to distribute these PPEs did not know who we are, where we come from, where we serve, what is our importance. So when they had to give us the N95 mask or more PPEs, regardless, they were always reserving for themselves or reserving for somebody else because they don't know who we are. We just the dental assistants, and they don't know who dental assistants are. And we all know that generally patients don't or people don't go to dental practices until they've got pain or they're uncomfortable with something that is happening in their mouth. That's only when they go, and that's only when they get to find out what a dental assistant actually does. That's if they can see you through their pain. Also, another risk factor was the safe use of PPEs. Sometimes you find professionals wearing a PPE mask. It's covered, but sometimes it's sitting here, sometimes it's off, sometimes it's on here. That alone was not safe enough. So we had to learn to use PPEs properly. Also, the proper disposal of PPEs and waste in general was another risk factor. You also found there were also times where in some practices where assistants would say there was no proper waste management practices. So now with COVID, they had to learn new ways or adapt to what the regulation says when it comes to waste management practices. And already on that was a burden on them because now you have adapted to all these new things that have always been there for you. It's a new world, it's a new thing. So that alone was just another impact risk factor on our assistants. Other risk factors outside the workplace, alcohol abuse. People started abusing more alcohol because they were either more at home doing nothing during lockdown, especially the first lockdown. And as you can all remember, we had all that 3 days to prepare. So people went and just bought a lot of alcohol. So now you find people who stay alone. What are they going to do? Drink alcohol? And eventually the alcohol finished, and then everything started kicking in that, wow, we don't know how long we're going to be in this pandemic. Also, another risk factor outside workplace is that when you are living with another healthcare worker or a frontline worker, you're thinking yourself, I'm already a risk to my family. And all these other people that also have to work during lockdown also are risk factors. So there are all these risk factors in one household. That also adds to the burden. Also having to be at work. Most of us found ourselves having to be at work. And the same line, our kids had to be at school. Sometimes they're at home. When they're at school, good. We were all happy and it was fine. But when they had to be at home and do online studies and you at work, that was another burden and another risk to think, I've left my kids alone at home. They've no one to be with, because we have relied on the education system to be our babysitters, the aftercare system to be our babysitters. Now suddenly there's no school, there's no aftercare, there's no one else. Your parents live far. You can't rely on them to come and assist because the roads are blocked. There's no permits. They're wherever they are. So now all of this is just becoming more and more and every day. And besides that, there were people who were still going through divorce. Regardless what lockdown was doing, people were still going through divorce. Some were going through separations. Some had problematic teenagers, problematic kids on their own. And some of us generally have poor psychological resilience to stress. And when that hit us, what we break down? Do we go to work? Do we sit? Do we wait for the employer to ask? What do we do? Do we take sick leave? Do we even have sick leave? Are we even granted sick leave for mental health problems? Also, if you have history with symptoms of anxiety and depression, it kicks in more. It happened previously, now it's going to happen again. And now it's happening at a heavier stress load. All of these things that I've just said adds to fear. You just build up more and more and more fear. What is fear? Fear is a response that a person has to unpleasant feeling triggered by a perception of danger or anything that is unknown. Currently, we sit with a lot of unknown. So that triggers fears in your mind. It triggers fears either physically or emotionally. But unfortunately, fear is not something that we can just erase out of our lives. It's a primitive human emotion. It comes, and when it comes, how do you deal with it? And besides fear, there are also other mental health challenges that come with fear. Our daily fears could be, you don't have a medical aid. When things happen, when danger comes, when you become sick and you don't have a medical aid, where do you go to? Even with people who had medical aids, when COVID struck and the hospitals were full and the numbers were high, medical aid was not going to help you. You were left to go to other alternatives, having to pay for your own COVID tests. Some employers can't unfortunately afford to pay for our COVID test. And in the States, you also pay for your own COVID test, unless you want to stand in the queue and wait 3 or 4 days to get your results. Usually when you're in that state of fear, you want your results to come today. You want your results to come now because you want to know, am I positive or negative? Do I quarantine? Do I self-isolate? What plans do I make? What is the way forward? So you might find yourself having to pay for the COVID test. Initially, when it started, we had to pay something like 1,500 for COVID tests. Then it went down. Currently, it's about in the region of 850. But still, 850 is still a lot of money for a dental assistant. Also, another daily fear is that if I get sick, do I get leave? Do I get quarantine leave? Do I get sick leave? Or is this leave deducted from my annual leave that I was supposed to take in December? Where does this leave come from? Not every employer can afford to give you leave because they need you in the practice, in the clinic or in the facility. Also, another daily fear is that some of us finding ourselves in a position where we don't have a say. Having a say does meaning you can try, but who's going to listen to you? That also adds to your fears. The updates on vaccine. Initially, when the vaccine was coming, they said it will come in April. Then we thought it's too late. And then the vaccine is here, but the vaccine is expired. And the vaccine is here, and then the vaccine is not enough, because currently, how many have had already received the vaccine? Does it really help if you get the vaccine at work because you're a healthcare worker, but your family didn't get it? Your family will only get it last. After all, there is close to 59 million people in South Africa. And I'm thinking that 59 million, it's South Africans. We're not talking about all other people that are in the country that needs to be vaccinated as well. We also sit with our daily fears of less daily patients. What does less daily patient means for the employer? It's a stress out factor. On the other side, in the public sector, you might be sitting with more patients that you can handle. Now you need to work with these more patients at with less staff, less hours in the day, and you still need to get through these patients. Another risk factor. Also, another thing that makes you fear, oh, that's time of the year again, HPCSA annual fee. It's March, today's the 3rd. You're thinking, I basically have 28 days before the 1st of April to pay this money. I don't have it. And HPCSA also has not promulgated the fees yet. You're like, how much is it going to be? How much hike is there going to be? But luckily for this year, they will give us time. They'll extend maybe till June, September, like they did in the previous year. So yeah, also another fear that we have. And you're probably asking yourself, can't they just pause for a year and not give us a free year? It's probably not going to happen. Also, another stress factor is anxiety. When you start to have all these fears and all these things that are creeping up in your mind, you start to be anxious. Anxious is as an adaptive way to cope with internal unknowns, characterized by excessive worry. You over-worry about yourself, about everything. When one is in a fearful, anxious state for a long time, stress may diminish your immune response to infections, especially viruses. Prolonged exposure to stress is harmful to the body and to the mind. This kind of stress may lead to cardiovascular diseases, something that you don't need. Stress, it's when the body or the mind is overwhelmed. It just doesn't know how to cope with all this pressure that is happening outside. It's either happening outside, they can see it, or it's happening in their own mind. Any type of change that causes emotional, physical, or psychological strain on the body and the mind results to stress. Then we've got another one, adjustment disorder. Adjustment disorder, it's severe stress that can lead to one to develop abnormal emotional behavior. And once this abnormal behavior happens, that's what we call adjustment disorder. It's very similar to depression, but it's not, because in this adjustment disorder, you usually have low mood and the behavior of the person changes. They suddenly act out of character. And you're like, what's happening to this person? Adjustment disorder. Depression. A lot of us speak about depression. A lot of us have heard about depression. Some have seen it, but we did not recognize that it's depression. Depression is something that we live with every day with our lives. Some cope better with it, some don't. Depression is a state of unhappiness or despondency. It's characterized by persistently depressed mood or loss of interest in activities or causing impairment in your daily life. Anything that makes you not feel like you don't want to live anymore. You just want to escape, you want to live, you don't even want to eat. But also at the same time, some people can hide it very well and we don't see it. By the time it hits rock bottom, then it's done. So we need to recognize these things in our friends, our families, our colleagues. And there's also post-traumatic stress disorder, PTSD, and acute stress disorder. It's usually this happens when you are reliving the past of current trauma, fear associated with avoidance. You've got nightmares. You've got irritability and sometimes numbness. You just feel numb. You feel like, oh, this day can just end. You know, anything that triggers something that has happened in the past, it leads you to PTSD. The impact of anxiety, depression, adjustment disorder, and PTSD. When you overthink these things, eventually they'll lead you to have fear of public space. You stay at home. You'd avoid public transport as much as you can. You even avoid people who are using public transport. You try in all your best ways to say, I don't want to leave home. But is it possible? You also have a fear of getting infected. And you've got a fear of taking this infection from the clinic, from the hospital, from the practice to your loved ones, and having to sit with the guilt. Because remember, if you are staying in a household where there's a teacher who's been in lockdown forever because they're not going to school, you've got kids, and you've got a partner maybe that works from home, and you're the only one that would be the one commuting every day between things. If somebody gets sick in the family, the first thing people think it's you. But what if the COVID came home with the bread, with a plastic wrap that has wrapped up the bread? What if the COVID came with a guy who was cutting the grass? What if COVID just got it in the air? But we are prone to think we are the first guilty people because we are the people that went out. We are the people that saw the sick people. We are the people that used the public transport. Also, the impact of that loss of a job, loss of income. This might also not necessarily be your loss of your income. It can be anybody. We all know or we've heard of people that have lost their jobs during COVID. And it had nothing to do with what they did at work or what they did not do. This was simply, it was not viable for the company to keep it open during those economic times. So they closed down. People lost their jobs, and maybe those people are sitting in your home. And you suddenly became the #1 nominated breadwinner. What do you do about it if you're a breadwinner? You know? And also not being able to see your loved ones when they are sick. Some people went and saw them, but you are probably one of the obedient ones that said, you know, I cannot go, I will listen to Mr. President and stay at home. But that got to you. Also not being able to attend funerals of loved ones. Some of us get better closure when we can say goodbye, or when we can go to the funeral, or we can see what happened. We get closure, we close the chapter, we move on. Some of us couldn't go because of either the numbers, or because it was a COVID death, or because of the regulations or anything, we couldn't go. Some people even mentioned the fact that maybe we even buried wrong people, because if it was suspected that it was a COVID death, you didn't get to see the cop, the body. You believe they gave you the right person. We'll see in the future. When anxiety becomes excessive or pathological, it's when you focus too much on negative news. There's a lot of negative news going around. When you focus too much on that, or you have excessive worry about getting infected. Some people are OCD about a lot of things. So when this comes, it becomes worse. So it makes their life to cope with things even worse. So you easily become irritated. Then you should know you're on the path of a mental health challenge. You can't relax. You can't sit. You can't sleep properly. You go to bed at night, but you can hear everything happening around you. You can hear the dogs barking next door at 2 a.m. in the morning. You can hear the cats in the trees at 11 p.m. at night. You can't switch off. All of these symptoms, you might end up developing difficulty in breathing, a racing heartbeat, numbness in your fingertips, feeling like you want to escape. All of this is called a panic attack. At some point or another, you felt something. If you are the type that can cope with all of this, it bounces in, it bounces off, you're good. But there's some of us who can't really cope with this, and it has become too much. And we're sitting at a point where we don't know what to do. We don't know who to ask. We've asked who we could ask, but we feel like you don't have enough information. Before we continue to the next slide, I'm going to ask Marlies to do the next poll question. Does mental health affect us all? Do you think mental health affects us all? I think they should be done by now. You can share the results, please. "95% of you said yes, and 5% said no. Thank you for the response. In my personal opinion, I think it affects us one way or another. If it doesn't affect you directly, it definitely affects the next person sitting next to you or somebody you know at work. So what we're trying to do as we move forward in all of these things that we've heard, a lot of negative things, avoid too much social media, because social media is like, sometimes it's negative news, sometimes it's fake news. And the more you hear negative news or fake news, the more you're about to live in it. And it's not helping for your mental health. Avoid angry and emotional people. When people are angry, when people are emotional, they usually say things that you don't want to hear or that they don't mean. And tomorrow they want to correct it, but they don't know what damage it might have caused to you. Avoid political influenced sources. Listening to political sources, we don't know what their agendas are. We know politics will remain politics. Also, too much current affairs is not good. Try to limit the amount of news you listen to. Every news station has its own agenda, its own vision, its own mission, its own things that they want to get out there. So it's better for you just to get 1 hour, 30 minutes or 30 minutes a day of news. That way you covered yourself with enough knowledge to move on the day. Too much current affairs has never been good because you end up absorbing information that you don't need in your life. Avoid people who you want to love you. We all know we are sitting in situations where we want approval of certain people. We want people to love us who don't love us. And when they reject us, it's another downfall for us. So let's try to avoid people that don't love you and you want them to love you. There are always people that love you. Find them. They'll give you love you need. Also avoid giving answers about COVID or any other thing that you're unsure of. It's okay not to have answers. It's okay not just to listen. Sometimes ourselves, human beings, we find ourselves when we listen to people who have problems, wanting to give answers, wanting to give solutions. It's not necessarily that solutions are needed. Most of the time, people already have solutions they want. They just want to vent out what's on their chest. Sometimes just listen. This is what you can do. Read peer-reviewed articles. Articles that are authentic, articles that have been peer-reviewed, articles that are published in credible journals. Don't have too many sources for information. Have 1 or 2 reputable sources of information, because when you have too many, you've got too many information in your head and you don't know which one to prioritize first. I've already spoken on the 30 minutes to 1 hour news daily. Have open conversations about COVID, about anything else, but make sure that it's open, it's honest. Another thing that I would like to plead with dental assistants tonight is the next 3 bullets. Don't expect your employer or your supervisor to have all the solutions. Sometimes they're just like us. They don't know what's happening. They don't know what's going to happen. They don't know what's going to happen tomorrow, just like us. Also be part of the solution. Suggest suggestions. Most of the employers that I know are willing to listen and to take on what you've suggested. Educate our colleagues. If you find yourself in an institution where your colleagues, especially the ones that you rely on for information, for PPEs, do not know who you are, educate them who you are. That way, tomorrow they will treat you better. Also, exercise, enjoy your hobbies, and keep in touch with people, especially loved ones. Exercising will help you in terms of staying healthy so that COVID doesn't attack you that easily. And if you do get it, that you can come out of it. Enjoy hobbies. Enjoy doing the things that you used to enjoy doing before COVID. Some of them are still safe to do. Some of them are not safe. I think we're all adults enough to know what's safe and what's not safe. But try to find something that you enjoy doing so that it can take away the focus from what is not important. Keep in touch with loved ones. We don't know how long they'll be around. Also, how to keep up. When patient flow is slow, try to keep busy. Be actively productive, be efficient, be effective. Address gaps in your practice or in your clinic or in your hospital. In every facility that there is, there's always gaps. Small ones, big ones. Try with the smallest one first. Address those gaps. Then your employer can see that this one is efficient. I cannot be without her, regardless. And if you find yourself where you're in an institution when the patient flow is not really slow, try to help out to minimize the stress for the person who's responsible for allocating, scheduling patients, also the person who's responsible for screening stations. Try to make things easier for everybody else. It also affects you at the end of the day. Make it easier for the employer. Save or reduce unnecessary cost. For example, if patient flow is slow, try to use your cloth masks rather than using your surgical mask, because in that time you'll be saving. The cloth mask can always be washed. Be available when you're needed. If you're needed to stand in for other staff and you're available and you're good, stand in for them. Reorganize your storeroom, your cabinets, throw away old expired materials. Try not to make the stress factors the highlight of the day. The more you think about your problems, your fears, your anxieties, the more they stay. They're not going to go anywhere. But if you let it go, even if they're still there, but they're not affecting you mentally. How to assist, but also we can also put in a way that what does exist? What does assist? An understanding employer, an understanding supervisor, and a supervisor or an employer that share information. It's better to share too much than to share little. An employer or a supervisor that implements measures to protect staff and patients. An employer or a supervisor that implement proper infection control measures and waste management. I know when I was speaking to some of the assistants, they said prior COVID, they used to throw their gloves, their face masks into the normal bin, your black plastic bag, your transparent plastic bag. But with COVID, most of their employers went out to say, no, guys, let's stop. This one needs to go into the red bin, the hazardous bin. So thank you for those employers that has made those changes. It's really needed. Also remember, as a dental assistant, that you are as valuable or important as you make yourself to be. I always tell my students previously, I used to tell them that if you're a dental assistant in a practice, be so efficient that the day that you leave, the practice go like, damn, we have lost out. Be the kind of assistant that when you leave, the next assistant that steps into your position can be valued and they can know that she's valued. Because if you were the kind of assistant that was just not worth having, when you leave and the next one comes in, she's also not going to be valued because now she has to prove a point. Do favor to the next person who's coming into your position. Even if you hate the position that you're sitting in because you hate the job, you hate the employer, you hate the salary, you hate whatever you hate, be your best because you never know when your potential employer is going to walk in. And you also don't know what people say behind you. Your employer can actually Your current employer can actually tell your future employer that this is the best thing I've ever had. And that's how you get your next job, with a better salary, better condition, better whatever. So try and strive to be, like Melanie said earlier on, be the best that you can be for your employer. We are here because of them, regardless how we feel. At the end of the day, all these emotions that I've discussed, they're very much normal. It's not something like COVID that fell out of the sky. It's always been there since the beginning of time. But now we're sitting in 2021. They are managed better, and there's places where you can get help. And according to SASOP, the South African Society of Psychiatry, they say without robust research or numbers, they say there was a 20% increase in psychiatric visit since the breakdown of COVID. And these cases are new cases of people who've never been to any kind of therapy, psychologists, counseling, people who have never even went anywhere. So it shows that even people who were resilient previously to whatever stress factors that was happening into your life needed help. And they went there and they got help. What's important is that you identify what you're going through. Is it just a fearful stage? It will pass. Are you going through anxiety? Is it stressful? Are you going through adjustment disorder? Are you going through depression? Identify the signs that you're going through and take it from there. Sometimes it's just fear. It will pass tomorrow morning when you wake up. Sometimes it's deeper than that. If it's deeper than that, what do you then do? Malise, the third question. Has COVID changed the industry? Do you believe it has changed the industry, or has it not changed it at all? I believe they are done. Definitely. Thank you. Dentistry, COVID has definitely changed. And we're never going to go back to that. It has changed for good, because now you are assured and you know where you're sitting that infection control is better, waste management is better. But yes, it is coming at a cost. It's also coming at a cost for the health, environmental people, more waste. But I believe they'll come up with ways of how to manage this waste. So those are the words of Kevin Henry. Kevin Henry is an American guy who's up for dental assistance. He's the best thing ever. He advocates for dental assistance. He speaks for dental assistance. He trains dental assistants. He also does free CPT points for dental assistance. So those are his words. And I think this is the last poll question before we close off, before I conclude. Do you need help, or do you know somebody that needs help? Whether it's COVID related or it's not, but somebody that is going through stress, anxiety, depression, PTSD, adjustment disorder. Thank you. It looks like a fair. 56% say yes, they know of somebody that needs help or themselves, and 46% say no. Thank you. If you need help, where do you go? You can start off by speaking to your employer, to colleagues. You can speak to other dental assistants, support groups. The only disadvantage with support groups, sometimes we tend to dwell on negative thoughts. We need to dwell on negative ideas before we actually get to the positives, but eventually it does get good. And also employee wellness programs in public sectors. If you need more than that, you can always go see professionals, registered counselors, psychologists, or psychiatrists. If you need, because you don't have a medical aid, if you need free confidential counseling, you can SMS this number, call. These are the healthcare workers care network. They would give pro bono therapy. They've got the resources. They also do training and psychoeducation. This is a collaboration between SASOP, SAMA. SAMA is the Medical Doctors Association, and also the Psychology Association, SASA, and DAS and SADA. Those are the people who deal with anxiety and depression as well. So if you are sitting in a position where you can't cope, things are too much, you're overwhelmed, and it's affecting your daily job, it's affecting your employer, it's affecting your patients, it's affecting your family, please get help. And there's also an email address which you can also email to, but that's a different organization. That's a COVID Care for South Africans. Pop them an email and they'll be ready to assist. Thank you very much. Dr. Mitsing, that's the end of
Thank you very much, Ms. Mutibi. I was also just as intrigued. Unfortunately, time is not on our side. You had to end, but I mean, you've raised very important points, and I hope that our dental assistant colleagues can take a lot from what you've presented. Thank you very much. I'm going to hand over to Ms. Elise Jacobs.
Good evening, everybody. Thank you. That was now really a very nice lecture. Can you guys hear me? Yes, you can.
Yes, we can hear you, Elise.
Okay, my presentation is not going to be a lecture as such. I just want to share with you a little bit about laughter therapy. Where did this all start? In 1995, Dr. Madan Kataria, a medical doctor, developed laughter therapy. He did some experiments in his practice and he saw what laughter can actually do for his patients. So now you're all thinking, oh, first of all, I want to thank SADA, I'm jumping the gun here, and Dr. Mitsing for inviting me to this seminar. I'm really honored. And I really want to salute all the dental assistants and all the dentists out there. I started as a dental assistant in 1987, and I had a lot of dentists with a lot of patients that taught me. And as I went along, worked in front offices, I learned from dental assistants as well. So I want to salute all the dental assistants, all the dentists, and all the dental fraternity, SADA and all your people as well. I really want to salute you guys for the good job that you're doing. So without further ado, you're going to wonder now, what is laughter therapy? Laughter therapy is a unique concept where we laugh for no reason. So how the heck can we do that? We use laughter exercises and breathing exercises. I just want to do this poll quickly. How often do you laugh with your patients and your dentist? Most of the day, 50% of the day, and not often. I think I know what this answer is going to be. We're all so stressed out, we don't laugh, but let's see what happens here. So we give a few minutes for everybody to fill that in for me. Interesting. Let's see what happens here. Most of the days, 36%. I'm very impressed. Not often, only 20%. So guys, let's try and get the 36% to 90 or 100%. Okay. So laughter is the most natural thing in the world. We look at babies and we see how babies can laugh for nothing whatsoever, and then life happens. We got nothing to laugh about. So in laughter therapy, we initiate laughter by doing exercises, laughter exercises, number one, and then breathing exercises. So what happened in COVID, we had a lot of people that were stuck at home. And we did these half-an-hour sessions, and the stress release that people had was just phenomenal. So I want everybody tonight that's in this seminar to maybe get your family or your partner, whoever is in the room with you, to do the laughter. This is a very, Dr. Mitsing, you're in for a thing here, hey? I need a laughter blaster, and you're going to be my laughter blaster. So to get the real benefits of laughter, you need to laugh for at least 10 to 15 minutes. But that's not possible in daily life. We can't sit and work and start laughing for 10 minutes. So that's why we do laughter sessions. So now you're going to wonder, how the heck is this woman going to make us laugh? I'm going to demonstrate first. We're going to do laughter exercises. Then we're going to do clapping. You're going to go, very good, yay. That's just to say, good for you. You got out of your comfort zone. Then we're going to do the breathing exercise. Breathe in and side out. And we're going to shake it out. So I'm going to do about 8 of these exercises. You can just follow my lead. I want everybody to get ready wherever they are. Just let your hair down, take your shoes out, maybe sit in a chair, stand up with your family if you need to. I'm going to sit down and I will lead the way. So, okay, the first exercise we're going to do, you're going to pretend you're going to phone somebody. So, Dr. Mitseng, you're on your phone, you're speaking to somebody, and you're going to laugh. Oh, nice, Mel, you're joining us. Please take your phone and you're going to start laughing. Okay, now we're going to go. Very good, yay. 3 times. Very good, yay. And number 3. Very good, yay. Okay, we're going to breathe in. And side out. Breathe in and side out. And again, breathe in and side out. And we're going to shake it out, shake it out, shake it out, shake it out. Okay, so the next one we're going to do is laugh and wave. Okay, so we're going to wave and we're going to laugh, okay? You in there, Mel? Where's Dr. Mitsing? Are you hiding? Okay, laugh, wave and laugh. Okay, very good, yay. And number 2, very good, yay. And number 3, very good, yay. Okay, we're going to breathe in again. And side out. And breathe in. And side out. And breathe in. And side out. Okay, and we're going to shake it out, shake it out, shake it out, shake it out. Okay, you're going to think this is really crazy, but stick with me. At the end of this session, you're going to say, wow, that's great. Okay, the next one we're going to do, you know, we all take ourselves so seriously, especially in the dental fraternity. We can get so serious. So you're going to point at yourself, get your family there, and you're going to point at yourself, and you're going to laugh at yourself. Okay, 1, 2, go. Yeah, there you go, Melanie. Okay, very good, yay. And number 2, very good, yay. And number 3, very good, very good. Yay. You breathe in again, breathe in. And side out. And breathe in. And side out. And number 3, breathe in. Side out. And shake it out, shake it out, shake it out, shake it out. Okay, the next laughter exercise. Okay, we always tell our patients, you must floss your teeth. That's very important. So in laughter, we got mental floss. So what you do, you're going to pretend you're taking a huge piece of floss, stick it into the one ear, pull it out the other ear, and you're going to floss. So let's go. 1, 2, 3, and floss, 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 floss. All the anxiety, all the stress, all the strain. I want to see you floss. Is everybody in your family flossing there? Very good. Let's go. Very good, very good. Yay. And again, very good, yay. And number 3, very good, yay. And we're going to breathe in, and side out. And breathe in, and side out. Number 3, breathe in, and side out. Okay, so shake it out, shake it out, shake it out. So the next one we're going to do, it's called laughter cream. Guys, this one takes away all your wrinkles, I promise you. So you're going to take your cream, going to open it, and we're going to do laughter cream. Open it. So do laughter cream. In front of the mirror, get all the wrinkles. Well done. All the wrinkles are gone. Very good. Very good. Yay. And again. Very good. Very good. Yay. And number 3. Very good, yay. And let's breathe in. And side out. And breathe in. And side out. Number 3. Breathe in. And side out. And shake it out, shake it out, shake it out, shake it out. So the next one, I know there hasn't been a lot of rugby around, but you know when those black and white guys come in there, what are they called? The All Blacks come in there with their war cry and their thing. We got a haka in laughter as well. It's also called the haka in laughter, the laughter haka, sorry. So it goes like this. It's all about breathing now. Hey? So you do ho, ho, ha, ha, ho, ho, ha, ha. Okay, you got it. So let's go. I will say when we stop, we can do this one for a minute or 2. So let's do the haka. Go. Ho, ho, ha, ha, 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 ho, ho, ha. Oh, very good. Very good, very good. Yay. And again. Very good, yay. And number 3. Very good, yay. And let's breathe in. And side out. Breathe in. And side out. And number 3, breathe in. And side out. And let's shake it out, shake it out, shake it out, shake it out. So the next one, we're going to get into a boat and we're going to row. We call it the rowboat laughter. So you're going to get into your boat. You're going to get the oars ready. So you're going to row and you're going to laugh. So let's go. 1, 2, and row. Row, and you're laughing, and you're laughing, and you're enjoying us. Okay, well done, guys. You're out of your comfort zone. You're doing well. So let's go. Very good, very good. Yay. And number 2. Very good, yay. And number 3. Very good, yay. Breathe in. And side out. And breathe in. Number 2. And side out. And breathe in. And side out. And shake it out, shake it out, shake it out, shake it out. Okay, so that we've done laughter exercises. Like you can see, if you want to do it with your family, you can use anything. My one friend in Durban, it's also a laughter therapist. He's got a mask one. So let's try the mask one. So put on your masks and let's laugh. Okay, well done, guys. Very good, yay. And number 2, very good, yay. And number 3, very good, yay. So breathe in and side out. And breathe in and side out. And number 3. And side out. And shake it out, shake it out, shake it out. So there you go, guys. We did 9 laughter exercises. And if you really didn't cheat, you would have been working up a little bit of sweat here. It's like a workout. So I just want you to sit there and see what, nice, Mel, you did well. You did this the right way, Mel. Good. Thank you, Mel. Okay, so what happens in a laughter session in your body? I just want to go through that with you. So to get the real benefits of laughter, you must laugh for at least 10 minutes, like we said before. So when you laugh for 10 minutes or longer, your body releases endorphins. We all know what endorphins are, the happy hormones that make us feel happy and that make us feel good. So yeah, your body releases the endorphins. So it's a free happy pill you get here. You just have to laugh. You don't have to pop a pill, okay? Okay, and another thing that happens, a lot of oxygen gets generated into your body. What happens if oxygen goes into your body? Your immune system gets boosted. So while you're doing this, your heart rate goes up, your blood pressure goes down, because it's like a workout. So if you do the laughter session full on for an hour or 45 minutes, like we normally do, it's like a workout. 2 years ago, we got a rugby team of a local school, I'm in George, and they challenged me, and I took them for an hour laughter session, and I'll tell you what, they were exhausted. So yeah, that's a very easy way of exercising. So let's see. Another thing that happens, when people laugh together, they work together. And I always, when I do with couples, I say when couples laugh together, they will stay together. So I want you guys to laugh more often in your practices. You know what? Patients come in there, they really don't care about technology or the good filling you do. They do care about it, but they take away an experience that they have in the surgery. And if there's an assistant, okay, I can't say you must have a smile on your face because you're wearing a mask. But you know what? Laugh often and laugh with each other. Dentists, laugh with your dentist if something happens that doesn't go the right way. Life happens, and you know what? Your patients pick up when there's a happy team working around them. So I want you to really go out there from tomorrow morning and laugh often and laugh hard, and the patients come in there and they feel it. We're living in difficult times. Like Tebatso said, it's fear, it's anxiety, and it's all sorts of stuff. We know all the lingo and what goes with it. And in dentistry, your patient comes in there and they're scared already. So let's laugh more often and laugh loud. So I just want to leave you guys with this one, how can I put it now? A clever man once said, you don't grow old. Well, you don't stop laughing because you grow old. You grow old because you stop laughing. So I want to leave this with you today. And please, guys, just keep on laughing and teach your family and your friends and your colleagues to laugh. So we can lessen the stress in this Yamaka world we're living in. So yes, that is my story in a nutshell. And thank you once again for everybody that came in and took the time to join us. And Mel, really thank you. I see you did your bit on the side. Thank you. Thank you, Dr. Mitsing. I went
Thank
a bit
you very much.
anticipated, but I think it went well. Thank you.
It did, Elise. Thank you very much. And I can't stop laughing. So just to put it out there, I cannot stop laughing. So at this stage, ladies and gentlemen, let me first acknowledge there was a comment on the comment section that we did not acknowledge the male dental assistants. So let me acknowledge our male dental assistants out there and apologize if in any way we made you feel like you were excluded or sidelined. You are part of the dental or the oral health team. So welcome, and with that, let us address the questions. Myself and Melanie will address the questions in the Q&A, but there aren't so many, Melanie. I think it's fine, I can do the questions.
Great.
So the first one is for you, Ms. Mutibi. What do you do if the practice does not give you enough time to properly clean? Patients are booked like crazy. You just get them in to get the money. You even work your lunchtime in until 5 o'clock. You're tired and you feel drained, but no one hears you. What do you do?
Evening. Thank you for the question. We know there are those practices where it's packed. You're literally on your feet the whole day. What I've previously suggested is that you manipulate the situation a bit. When you book patients, allow yourself that extra 5 minutes in between, where I know that the employer will see it, but allow yourself not to book patiently directly after each other. Allow yourself that 5 minutes in between. It will give you enough time to pick up the tray and do a proper cleaning, proper disinfection. That's what I could think of for now, because it's not necessarily going to reduce the patient flow, but it will give you that 5 minutes break to go drink water, go to the loo, and prepare for the next patient. Thank you. And also another thing that also works is that not booking long procedures repeatedly after each other. Have a short one in between that allows you to, while the dentist is working or the therapist or the oral hygienist is working, doing something else, then you can quickly do something else, prepare the next tray, but remember to take off your gloves when you're doing something else. Thank you.
Thank you very much, Tebatso. And then we've got advice. I think this is related to what Elise has just presented. We've got Dr. Norman Clement, who's a regular attendee from the United States. He has shared some blogs of his, and he says that people must view those blogs, and Dr. Norman will take them and will share them with members. SADA will take them. And he says also for stress relief, the therapy that he uses is he laughs with a golf. He laughs with a golf, I think it's a golf ball, and he break dances every now and then. So just dancing to your own tune, Dr. Norman does that. So there's something else, Elise. And then we're going to a comment by Dr. Tshwane Oosthuizen. Dr. Tshwane Oosthuizen is no stranger to everybody on this platform, especially to SADA. She says, the dental profession in South Africa has come a long way since what, my apologies, has come a long way since what we remember since the 1990s. Thank you to SADA for taking the bold step of formally recognizing the dental assistants in South Africa. Together as a dental team, we are so much stronger. And I think that is absolutely true. The dental team, as I said in the beginning, would never be complete without the dental assistants. And I repeat again, I've worked with very wonderful dental assistants throughout my career when I was still in practice. So I'm reiterating what Dr. Tshwane Oosthuizen has said. And then we've got an anonymous attendee who has just placed a compliment there to say, very good presentation. Colleagues, I think that concludes the questions that we have in the Q&A section, as well as the comments. I'm going to give Melanie just a parting shot, just to say a few words, and then we're going to close the session.
Thank you. And I think it was a fantastic session. I didn't know Elise well, and I really, really didn't think that I would laugh and I wouldn't participate, but I did. I was on TV or YouTube, but I thoroughly enjoyed it. And I must tell you, it really works. So I would say the same thing, laugh a little more. With the first lecture, I must tell you, it was incredible. You know, I think you've addressed, TV, all the worries of dental assistants, and every little bit that I've been out in the field and listened to, you've addressed them. And I think it is so good to actually have this platform. And I wish we could have more dental assistants participating and seeing how good this platform really is. I thank you, and I thoroughly enjoyed it. And thanks very much for having me on here.
Thank you very much, Melanie. I think we've got a few dentists that are actually paying tribute to their dental assistants. So I've gone back to the Q&A panel. Just my apologies. We've got Dr. Singh here, Jitendra Singh, who is saying that she's very grateful to her assistants and they are a very valuable part of her team. So assistants that are working for Dr. Singh, there is your compliments from Dr. Singh. And then there are one attendee is requesting if we can provide the audience with the contact details for assistants to approach with any general questions. I think we will make that available. I will speak to Dr. Tshwane Oosthuizen as well as Mutibi, and then we can formulate that. We can formulate a platform where dental assistants can ask their questions that they would love to ask. With that, I think we have come to the end of our beautiful evening, and I think we are concluding it with a nice shake off from Elise. So thank you very much to all our attendees, and your certificates will be available on your profile as soon as possible. So that concludes our evening. Thank you very much.
Thank you.
Thank you, ladies. I'm going to close the session now.